Hello and welcome to the Center for Maritime Medicine's session on death at sea. By the end of this session, you'll be able to describe and perform the care of the dying, identify 4 signs of death, list 2 conditions that can cause a death-like state, list the steps to take after death on board, and describe management of a body including indications and procedure for burial at sea. Now, one of the important things to remember about life is that everyone dies, and it may be on your watch that somebody dies, that you're responsible for them. For older individuals, it's going to be medical causes more often than trauma. For younger, it will be traumatic injuries more often than medical. But what's most important for you is that this is your crew and your colleagues that you're going to be dealing with. So these are people that you know, these are people that you work with. It's going to be very hard to accept their death and dying. So, how do you deal with dying patients? First, how do you know that they're dying and there's nothing else that you can do? That's a hard call, and it's one that you need to discuss with medical control. But if people have fatal injuries, if people have illnesses that require much more care than you can provide, if they're getting much sicker no matter what you do and there's no chance that you can evacuate them, then you have to consider that you need to change your focus. And changing your focus means going from an aggressive stance of doing everything you can to try to keep them alive to instead a stance of providing them with dignity and comfort, complete relief from pain, and communicating with the patient and recording any final words or other communications they have. And that's your responsibility as the care provider. So once you think that you know that the patient is going to die, talk to medical control. Or if you have questions about it, talk to medical control. The master will notify the next of kin, and your job is to keep the patient comfortable. And this may include something called palliative sedation, which is giving them medications to the point where they're unresponsive but no longer feeling pain. And that's a conversation that you have to have with medical control to sort this out. Then what happens? Well, eventually they'll die. But there's no rush in saying that they're dead. It's not that they're going to get any more or any less dead. Once they die, you can take however much time it takes for you to confirm that they're truly dead. Because it's much worse off to say they're dead and it turns out that they're not, than to say they're not dead when it turns out that they are. And in 3 to 4 hours, if they're dead, rigor mortis will set in and you'll know for sure. So what are signs of death? Well, they aren't breathing, and you should listen for up to a minute, possibly 2. Put your ear over the patient's mouth. You'll feel the air movement. You can hear air movement. Listen to their heart. They won't have pulses. Listen to their chest with a stethoscope or your ear. You won't be able to hear the heart beating at all. Their pupils will become what's called fixed and dilated. That is, they won't respond to light, and they'll be large, not small. And they won't respond at all to painful stimuli. So take your time going through and checking all of these things to make sure that the patient is truly dead. Because there are some almost dead states, people who are not quite dead because of underlying conditions, and you don't want to get confused about this. So a hypothermic patient can appear dead, appear to have no pulse, appear to have no breathing. So you need to make sure that their core body temperature is at least 90 degrees Fahrenheit or 32 degrees Celsius, and then go through your process of confirming death. No breathing, no heart sounds, pupils fixed and dilated, and no response to painful stimuli. Drug overdoses, narcotics like benzodiazepines, barbiturates, opiates, those can also simulate death. And so talk to medical control if you're not sure. And again, if they're dead and you call them not dead for a while, that's not a problem. But if they're not dead and you call them dead, that's a problem. After death, you need to focus on the survivors, and that includes yourself. This is going to be a very traumatic incident for the crew, because typically it will be an unexpected death. And so you need to make sure that other people are handling this okay, and that you're handling this okay. You need to answer the question, why did the patient die? Was this an infectious disease? Do you now have to turn your attention to controlling an epidemic spread of some communicable disease that could kill the entire crew? Is this a crime scene? You need to preserve evidence. And if that's the case, that may mean preserving the scene and preserving the body without doing anything else. But if it's not a crime scene, if this is a natural death, you've discussed it with medical control, you're comfortable with that, then you can clean and dry the body, empty the bladder either by pressing on the lower part of the abdomen or putting in a urinary catheter and removing it, plug the rectum and nostrils with cotton, dress the patient, at this point the cadaver or the corpse, shut the eyes, and you may have to tape them closed, interlace the fingers on the thighs and comb the hair, and bind the feet together. You're going to record details including the patient's name, date of birth, address, and next of kin, the circumstances leading up to the death, describe the body itself, including photographing the face, any distinguishing marks or injuries, and documenting those as well. You want to record what clothing was worn at the time of the death and bag it and keep it for authorities if they want to look at it. You want to bag and secure their personal effects. You want to copy any medical records that you may have. You need to document the time, place, and ship's position of death. You want to take statements from the crew regarding the death. Although you won't necessarily have to get statements from every crew member, anyone who knows anything about what happened, you should take a statement from them. You need to document who determined death and who provided medical control to you when you determined death, and any last wishes or messages should be recorded. So what do you do with the body? Well, you need to store it in the cold. So put it into a body bag or sew it into a shroud of some sort and place it into a refrigerator or freezer unit and turn it over to the authorities as soon as you can. Why would you perform a burial at sea? Well, if there's no way to preserve the body, and if the body in some way poses a threat to the rest of the crew, you need to discuss this with medical control and properly document that medical control concurred that burial at sea was the only appropriate choice. You need to notify shore authorities, and then the body is sewn into a weighted shroud with a gas vent in it to allow the gases of decomposition to escape. You perform an appropriate service and committal and record the time and position of the committal. Please complete any associated knowledge reviews, and if you have any questions, contact your professor or instructor.